Hello and welcome to the Winner's Circle. I'm your host, Dr. Sean T. Hubbard. I'm a hospital neurologist and I've been practicing for a handful of years, a couple decades. During that time, we have been dealing with problems and we deal with the prevention of those problems, and then hopefully we try to help our patients to win. And that's ultimately what this show is about, how to help our patients do well, discover well-being, and ultimately to discover victory and health. And so today, I am joined by a colleague, Dr. Jenice Baker. She's an emergency department physician, and we've been working together for probably a couple of years now, several years. She's going to help us to understand I would say, the elephant in the room, ultimately COVID-19 we've all been dealing with in our communities as well as in our country and in our world. But first, before we jump in, Dr. Baker, what made you become an emergency department physician?
Thank you, Sean, for giving me this opportunity. I'm happy to help our patients win. Why I became an emergency room physician? I've always known since I was young, about 8 years old, I wanted to be a doctor. And I think early on, I always said a pediatrician. I think that is something that a lot of women physicians may gravitate to, just instinctively with this maternal instinct. But I found that going through medical school, I loved learning about everything.
Sure.
About cardiology, neurology, traumas, procedures. And emergency medicine is the space where I'm able to literally do everything.
Wow.
I will have different types of patients walk through the door, and I'm responsible to take care of them and deliver that care at a very stressful time in their life. And sometimes it is about life and death.
Sure, sure. Wow. You alluded to your road to becoming an emergency department physician. I wonder if you could describe that. Sometimes I even take for granted when I get up and go to work every day that I'm practicing medicine. You know, it just becomes a natural. But remind our guests how you became an emergency department doctor.
So I think that's a good question, and especially for anyone thinking about medicine, you may see your doctor at the end and trying to think about the process, and it may seem overwhelming, but it is definitely something that anyone can do if you have that interest and you have that drive. So first off, you have to go to school, you have to go to college, but you have to also prepare for an MCAT test, so your medical school admission test, or medical college admission test. And then you have to only take certain prerequisites to apply to medical school. And I think this was something I didn't realize. In medical school or in undergrad, a lot of people were biology or science majors, but you can be an accounting major, you can be an arts major, you can be a history major. It's very important to still fulfill your interests, and you can still apply to medical school afterwards. It's just mainly having these prerequisite courses.
Perfect.
And then you go to medical school, and that is really the time where you sort of get this introduction to medicine, and you get to see every and anything. And during that time frame, then you kind of make your decision in which path you'll go down. And then you do residency, and they call it that because you basically live at a hospital. And after you finish your residency, you become an attending. But I think during that process, the biggest thing that you have to have is a belief in yourself that you'll get through it. There'll definitely be challenges.
Sure.
And finishing medical school or residency will not be the end of your challenges, but just knowing that you can get through it and having a good support system. I've definitely had that with my family, with my friends, and with my colleagues. So I think that's sort of my path and my journey.
Perfect, perfect. So now you were describing those years, and they're starting to add up in my head there. So it sounds like you were talking about college, 4 years.
Yes.
Did you study in undergrad like biology or
So I
chemistry?
did a biology and society, although I just said you don't have to, but I did.
Okay.
But
so
yeah.
Biology degree, and then
And
that's
then
4 years. Then
4 years, my medical school degree.
Okay.
So that's 8 years, and my emergency medicine residency program is 4 years.
Okay.
Majority are 3 years.
Okay.
So that's another 4 years. So 12 years, and my kids, my daughters will say, oh my gosh, that's school forever. But I always say the 12 years are going to go by anyway.
Right.
You're going to become 40, 50, 60 anyway. So I don't let the time of how long something will take be a factor in not doing it. The time's going to go by anyway.
No doubt, no doubt. Thank you for that. So then, how long have you been practicing as an attending?
So a decade, more than a decade, actually.
Okay.
12 years. So.
Okay, great. Well, I feel honored to have you here on the Winner's Circle. That's a lot of experience and training and education.
Yeah.
So, as an emergency department physician, you must be seeing a lot of people with a variety of conditions, really. Traumas and breaks and sprains and colds and all that stuff.
Chest pain, belly pain, anything, headache.
Okay,
Yeah.
wow. But now we have this significant issue that has changed us and changed our society and changed how we live at home, how we go to work, How has COVID been different for you? You've been practicing for more than a decade.
Yeah.
What's been different about 2020 for you?
So COVID has definitely changed the landscape, and as you mentioned, it has changed how we live at home, personally, how we professionally work, and for me as a clinician, it's definitely changed my practice. The first off, because of the quarantine and social distancing, which is very important in making sure that we keep COVID manageable. It has decreased the volumes of patients in the emergency department, first off. But it's also decreased the amount of traumas because people aren't driving to work, so there are less car accidents. We've decreased a lot of injuries that children may have as playing sports or having falling off of a jungle gym just because kids are home and less sports are going on. So those sort of things have decreased. It has also, though, decreased the amount of patients that I've seen who are coming in with chest pain or maybe having a heart attack, patients who may be having a stroke, patients who may be having some abdominal pains. And that actually is concerning as an emergency room physician because I know that my patients out there still have underlying disease processes.
Right.
They still have high blood pressure, they still have diabetes, they still have high cholesterol. So they're still having these problems. And COVID, a pandemic that's going on, is making them scared to seek help. I remember taking care of a patient, and he had had a heart attack in the past, and this is during COVID, so this was back in March, April timeframe. He began feeling chest discomfort, similar to his heart attack pain. But he waited, or he delayed coming to the ER because he didn't want to catch COVID.
Wow.
He eventually came later, but it just decreased the options of care that we can give him and the best options because now heart muscle has died.
That's right.
And so that has been one unfortunate consequence of COVID where patients are trying to make this decision over their immediate health and their risk of contracting this disease.
That's right.
And then the elephant in the room is COVID, just a lot more COVID patients coming in.
Right.
And by the time they come to the emergency department or seeking care, they are very ill and having to have this influx of critically sick patients to take care of.
Wow.
And that's partly of why we're doing the social distancing and some of the quarantining so that this healthcare system can take care of those very sick patients.
Wow, that's right, wow. So now speaking of patients with COVID, I remember back in the spring, actually before spring started, February, there was this sort of teaching that we would hear. We would hear about COVID coming from China and a couple of people in our Northwest, and we were trying to get ourselves ready about what patients with COVID would look like, what they would complain of. What's your experience been? What are patients complaining of?
So, you know, COVID-19 is a coronavirus. It's a viral syndrome. And so you'll have patients who come in who complain of normal viral symptoms that we're used to. So maybe they may have fever, they may have cough, they may have throat pain, they may have some mild shortness of breath. Some of them may even have stomach issues or GI problems where they have abdominal pain or diarrhea. And then very ill patients, the ones that we're really seeing that need hospitalization and may need additional care in an intensive care unit or a step-down sort of unit, they have much more respiratory complications. So they're developing what we call COVID pneumonia and having to deal with that where we may have to give them additional oxygen and at the extremes really have to breathe for them or put them on a ventilator.
Wow.
And so that's more so the sick, that end of the spectrum, very sick patients, what we'll see in the ED and then have to admit. If you're coming in with the mild symptoms of a virus, a runny nose, sore throat, body aches, and fever, you know, luckily for you at the time, those symptoms are enough where your body can handle it. And we can do supplementive care, Tylenol, Motrin, rest, fluids. But that quarantine at home and stay away from individuals if you feel sick is very important because that is when you are the most contagious. So we want to make sure that patients do that.
Wow, you know, so you mentioned a lot of symptoms and a pretty significant variety. I have a son who's in college, and he called saying that he was having congestion and runny nose. He's in Florida, and so we were worried about him because college students do what college students do, and this was back in August. But we were wondering, you know, is this COVID? So how does one distinguish? I mean, you're seeing people on the front line. Somebody's coming in with a runny nose. Somebody here has congestion. Another one has shortness of breath. I mean, all of these different respiratory symptoms. How do you distinguish?
So that's a good question. And a lot of it is using clinical skills and Gestalt and getting that history. So definitely, if that patient has been around someone who has had COVID-19, then that makes it more likely that it would be COVID-19. other things on. With the flu, usually the high fever comes on very suddenly and suddenly with body aches, and we're coming into that flu season now.
Sure.
And so if it's very sudden body aches, high temperatures in a short time frame, that makes us more likely to flu. But here is where I'm going to stop and plug, get your flu vaccine. Because if you can get your flu vaccine and prevent yourself from getting the flu, one, it kind of helps decrease your risk of getting sick from influenza, which also has some risks associated with it, but then also decreasing the stress on the healthcare system with having to take care of flu patients as well as COVID-19 patients.
I see.
And the thing with COVID-19 also, it's usually there might be some mild symptoms early on, but then maybe 5 to 7 days later, that is usually when you'll see patients who will develop more worsening symptoms from it. That's when it comes on, so a little bit later.
I see.
Initially, it may be very difficult to tell the difference. And a lot of it is going to be watch and wait. But as an emergency room physician, I always want you to come back to the ED if you're not feeling well.
Sure.
It's never to just go home and deal with it on your own. It is we're going to watch and wait, see what your temperature is, see how you feel, see if you're able to keep down foods, see if you're able to hydrate. But if you get worse at any moment, always come back to the emergency department.
Perfect, perfect. So we dealt with the symptoms and what people describe during your interview. It sounds like you're able to figure out a lot just from talking to patients. And luckily, I mean, many times, and the person that trained me, Dr. Schwartzman, would say if you get a chief complaint and you know the patient's age, then you're already 85, 90% home with regard to diagnosis. But then we have to do an examination. Are there any features on examination that help you distinguish one entity from another? Let's say common cold from flu. I know a lot of people are concerned that, hey, flu looks a lot like COVID from COVID itself, or even bacterial pneumonia.
Right. So bacterial pneumonia, definitely patients look much sicker and definitely will have a fever for a longer period of time.
Sure.
There's some concern about if you're coughing and if you have a productive cough, and the color, that actually later on the evidence is shown having a colored cough, so yellow sputum versus white sputum, doesn't always delineate between viral or pneumonia. But usually pneumonias, bacterial pneumonias, are much more ill in presentation. I think, though, for COVID-19, when we're thinking of that where it seems like it's a virus, but the patient comes in vital signs-wise, they tend to be very hypoxic, and that is a low oxygen count. And that usually is one hallmark feature of COVID-19 when it is a severe infection enough where a patient needs to stay in the hospital. They will have oxygen levels that are very low. So normal oxygen levels for a normal person, for you and I here sitting, will be between 96% and 100%.
Sure.
That's great, that's normal. And if you have an infection in your lungs, that means you breathe in, but that oxygen you breathe in can't really get to your blood. That number will drop when we're measuring it from the blood. So that might drop to around 90%, and that's concerning. We want to be near 100%. But COVID patients that are coming in and they're saying, I feel really short of breath, it's hard to breathe, you look at that number, and in some cases, it's as low as 80, 70.
Wow.
Even I've seen patients at 40%, but they're still talking to me. That is not usually the case with patients with a bacterial pneumonia, where their numbers are only maybe high 80s, but they are significantly in distress with their breathing, and then I have to support it. So that's sort of one of the issues, the hallmarks. Then we'll say this is probably COVID, and that one, we already know we have to keep you, but we have to supplement you and give you additional oxygen to help you with your breathing.
Wow. Wow. That's a lot of information. And it sounds like you're able to put it together in a short period of time, really.
Well, that's the hallmark of an emergency medicine doctor. We usually don't have a lot of time.
Brief period of time.
Brief period of time, and taking in a lot of information, synthesizing it, although no, we may not have all the information, and making the best treatment plan with that limited information.
Okay. And real quick, what are the first couple tests that you order? You mentioned the pulse oximetry.
Right, so that's with your vital signs, your blood pressure, but definitely we're going to do a chest x-ray. We want to look at those lungs and see if we see any fluid or signs of pneumonia. COVID pneumonia kind of looks what we call an interstitial process, usually on both sides of the lungs. It has this pathognomonic appearance, so we want to look and see if we see that. We want to do blood work and see if they have other signs of infections and such going on, a high white count or a low white count. So we do a whole workup, and also remembering as an emergency room doctor, I'm ruling out multiple things. So it may not be COVID, but I have to also think of other things. It may be congestive heart failure. It could be related to your heart. It could be related to underlying lung disease, COPD or bronchitis. So I'm still working up all of those things during a pandemic.
Right. Excellent. Excellent. Wow. Well, I really feel informed about what patients will actually talk about and what you see on examination, as well as some of the tests that you do. That thing that we put on people's fingers, that pulse oximeter, and when to be really concerned, and some of the first steps. I think we'll take a break now, and once we come back, we're going to ask you about treatments that you'll start in the emergency department. And then after we get the treatment, I'm going to ask you the big question about Dr. Baker.
Okay.
We'll see you right after the break.
Number 7. Number 8.
9 regular. Oh, wait. 13 giant. The usual?
Of course. Number 1.
Jersey Mike's, a sub above.
Today's show is sponsored by Dr. Jacqueline. Take charge of your life personally, financially, and professionally. Visit drjacqueline.com to book an appointment today.
Hey everybody, my name is Ralph Graves Jr. I'm the host of the Ralph Graves Jr. Show, and I want to invite you to pick up my book, Unstoppable. I wrote a book called Unstoppable. It's 7 universal laws that will transform how you pursue and achieve success. The one thing that my 20 years of law enforcement has taught me is that no matter who you are, we are all governed by universal laws, like gravity. But in this book, we're going to talk about laws like the law of forgiveness, laws like the law of control, the law of intelligent practice, the law of expectancy. I was able to see how those, no matter what their background was, those who identified and treated these laws with respect, they were able to go on and lead successful lives. So pick up this book, and you can go ahead and pick it up at Amazon.com, BarnesandNoble.com, RalphGravesJr.com, where anywhere where fine books are sold. Thank you.
Hello and welcome back to the Winner's Circle. I'm Dr. Sean, your host. And for some of those that are just joining, I am joined by Dr. Jenice Baker, an emergency department doctor who has been filling us in on COVID-19. She's taught us quite a bit so far, how people come in complaining of COVID, how they complain of multiple respiratory conditions and how we distinguish those, and how you can distinguish those even yourself if you're understanding and paying attention. Some of those things that she'd be looking for on examination, as well as some of the early tests that we perform. I think you mentioned the chest x-ray. And so now the big question is, what are we starting from a treatment perspective in the emergency department?
So one thing to realize, because of how COVID is transmitted and its respiratory droplets, when you come into the emergency department and there is even a concern that you may have COVID symptoms or respiratory symptoms, you're going to be put in an isolation room.
Sure.
And this may be a little bit different than how you've received care before in your emergency department. And it's usually a smaller room or just a normal sized room, but you're going to be by yourself. And early on in the pandemic, patients didn't have visitors, and that sometimes was something a little bit difficult for patients to deal with, but part of it is trying to limit exposure and limit the spread of the disease.
Sure.
The other thing to realize is that all of the healthcare workers will be wearing PPE or protective gear, and so you may not directly see our faces. We will have goggles, shields, face masks, and gowns, and also to protect ourselves from contracting the COVID virus.
Sure.
So just understanding that, you'll be in this isolation negative pressure room so that anything that you breathe out, if it has COVID particles, it gets taken by negative pressure out of the room. So that's the reason for that type of room. Then you'll be hooked up to a monitor, you'll have supplemental oxygen, but if your oxygen levels are very low, like we talked about before the break, you may need to get supplemental oxygen, and so sometimes patients are put on what we call BiPAP or positive pressure ventilation. And actually that is one of the things that we've learned during time that actually has helped COVID patients more than going straight to ventilation where you put a tube specifically to breathe for them.
Sure.
What's different between the positive pressure ventilation is the patient's still breathing. We're just giving a little help, a little pressure to help that oxygen get into the lungs and then that oxygen in the lungs to get to your blood. And so that is something that probably would be started if you need to be admitted.
Sure.
You'll also get antibiotics in case, as I said, as an emergency room doctor, we can do the COVID test, but it doesn't always come back right away, and you're sitting in front of me and we have to make treatment decisions now.
Sure.
So you may get antibiotics at that time in case you have a bacterial infection or a bacterial infection on top of a COVID infection at the same time.
Wow.
And you may get steroids as well.
Okay.
Those steroids are there to sort of help the body calm down the response because it's thought that the over-response, immune response to the COVID virus is partly what sort of causes a lot of the problems for a patient with it. So you want to help modulate that response as we're giving treatments.
Goodness. Okay. Wow. Okay, so I never thought about isolation per se as a treatment, but so isolation and oxygen, positive pressure, steroids, as well as an antibiotic to get started.
Yeah.
Okay, those are nice treatments, and I can see how the steroids we're talking about Decadron,
Yes,
dexamethasone?
so Decadron or Ciamedrol or prednisone, just depending on different types and if a patient is able to take orals or they need IVs, but just steroids to calm down that severe response that the body may have to the COVID-19 virus.
Now, does everybody get admitted?
No, no.
Okay.
And that's actually something as an emergency room doctor, depending on what you may come for. May come for a headache, chest pain, or viral symptoms. Everyone does not get admitted.
Sure.
So you may have signs of COVID, you may have a positive COVID test that comes back, but if you are able to take care of it and your body is dealing with it in a normal way where your oxygen level is not impaired, you have mild body aches, a low-grade temperature, we'll send you home to quarantine at home. You can take Tylenol, Motrin, and fluids, and to stay home until your body creates its own antibodies to fight it.
Sure.
And so, just to be clear, I may have said antibiotics because maybe a bacterial co-infection, but COVID-19 is a virus, so antibiotics will not treat COVID-19. Your body has to make its own antibodies, and you have to give it time to do that.
Sure. Wow. Yeah, you know, so you're letting me know about people that I don't see because I'm I'm in the hospital and I see everybody that gets admitted, but I don't see the people that go home.
Right. So there will be a lot of people that do go home.
But the scenes in the hospital over the past 9-10 months, I must say, are different than I've seen in 20 years. Walking through the intensive care unit, seeing ventilators out in the hallway, seeing patients not laying on their back and looking at you, but laying on their stomach and prone, different treatments that are provided in intensive care unit. It's really changed a lot of what we do and what things look like in the hospital. These ventilators are out in the hallway and they're obviously plugged up in the room, so now you had plugs and cords that are going all over the floor. It's really a different scene and a different scenario. And it's changed even how we have patients and their families visit while patients are in the hospital.
And that is because we're trying to limit exposure to those respiratory droplets.
Sure.
So that's why those ventilators are outside where our respiratory technician, your pulmonologist, your intensivist can make modulations and changes if necessary. But yes, very early on, or if a patient is in respiratory isolation, they may not be able to see their family. But just like we're using technology right now to help bridge that social distancing gap, that's where we're even using technology in the hospitals with using iPads or teleconferencing where they can see their family via screen at least. But yes, it definitely has changed the way in how we administer care in this time frame.
You know, what I found remarkable about COVID itself is that I would go in the hospital and see such a crazy scene. It looked like a war zone in some places. I mean, I was literally stepping over cords and just everything looked different than it ever looked over the past 20 years. And, you know, so I just really found this really remarkable. And then I'd leave work and walk out the door, and of course it was the spring. Now you have trees that are starting to bud. I'd go out there and I'd see birds. I mean, hear birds chirping away, you know, some traffic in the street, you know. So the lifestyle and what we experienced in the hospital and what was going on outside, especially in the Northeast early on, it was like two worlds. And so I could see where it would create this scenario where people that are, let's say, where COVID had not happened yet.
They may not see it.
Yeah, they may not see it.
And say what's going on, but it's definitely real and going on. And Now we're seeing that happen all over the country.
That's right.
Now we're seeing that happen all over the country.
Sure,
yeah.
sure. So, well, I'm glad to talk to you about this. And, you know, I think that we understand the problem a little bit more, and we understand how you assess it, what sort of tests to do, and some of the treatments. Sounds like a big problem. How do we just prevent this?
Exactly. I would prefer, as an emergency room doctor, not for you to come into the emergency department.
Sure.
So social distancing, it works. And also wearing your mask, it works. For our healthcare providers, we are in PPE, so we're in masks and covering, and we're taking care of COVID-positive patients, and we have been skilled enough in using those protections to not get COVID ourselves. And so you can do this outside of the hospital as well by limiting exposures. Non-essential travel is not necessary, and if you have to go out in the community, to make sure that you wear your mask and stay 6 feet apart if necessary. And if you feel yourself coming down with any symptoms, body aches, fevers, runny nose, anything like that, then stay home and self-quarantine. And those measures really will work in keeping the virus manageable. And when I say that, so that if you do need help, that the hospitals are available, that the ICUs are available. It's not that COVID-19 is going to disappear. We are going to be living with it, just like we've learned to live with flu and other diseases and viruses and such, but learning to manage it until we are able to come up with better treatments, hopefully a vaccine next year, or maybe some other treatment processes, but we need to do our part in stemming the exponential growth of COVID-19 within the population.
You know, I think I learned a lot about COVID on a particular day. There were a couple of instances, really. I'll tell you about one real quick where, as a neurologist, I didn't think I was going to be seeing much COVID. And so I thought, okay, people are going to be coughing, runny nose, sneezing, all these respiratory symptoms. I'm not really going to be dealing with this as a neurologist, but I'll pay attention and see what happens. So early in March, I was asked to see somebody who had passed out, and that was before we were wearing PPE and masks in the hospital. We would only wear masks initially if we were talking to somebody who had respiratory symptoms. Now, here was a patient who had passed out, and then I saw them. 3 days later, infection control comes to me and says, hey, remember that patient that? I'm like, oh, no. She has COVID. So now we changed our game, and we learned a lot.
And that's actually a good point you bring up. There are other sequelae we found of COVID-19 where some patients get increased procoagulable symptoms or clots. And so that passing out could have been a stroke. And that is something that we've seen with some patients with COVID-19. And so they may not immediately present with these respiratory symptoms that are most common, but not everything always presents commonly. So that definitely is a side effect. And that's why any patient coming in, we are all in our face masks, we're all in our goggles, because you just don't know.
Absolutely, absolutely. And I learned a lot also once I was in the ICU, and now every time in the ICU I come across patients that are getting dialysis, and so they're in a room by themselves with a sliding glass door and everything, and there's a nurse there who is sitting with that patient with a closed door. So it's a very enclosed, small room, and the nurse is sitting there for hours. I mean, dialysis is going on for 3.5 to 4 hours, but she has her N95 on, she has her surgical mask on, and doing well.
Yeah, exactly.
So we see people, it works.
PPE works. Wear your masks. Wear your masks. It works.
That's right.
It really does.
Sure, sure, sure. So yes, that's right. It does make sense. I mean, if there's a barrier there and if there's distance, I mean, obviously somebody who's down the street, they have COVID, there's distance. It's not going to affect us. And if they're in the next room and there's a barrier, I mean, barriers seem to work.
To work as well.
Yeah. So that's Dr. Baker, it sounds like, at work, but I know you're not at work, and I hope you're not at work all the time. You still have to deal with COVID at home and go shopping, and you have a family,
I have
I'm sure.
family and I have kids, so I have 2 daughters, and I'm remote schooling them, right, because COVID has affected all of our lives.
Sure.
And my husband, he is working at home, at least right now he's able to do that, so it's definitely changed sort of what the home landscape looks like.
Sure.
And I think that, you know, trying to make these decisions as a parent, what to do is very difficult. difficult. And I've told a lot of my friends and colleagues, you really have to make the decision that's best for you and your family. I understand if you need to send your child to school. I understand if they're very young. My children are a bit older, and understanding that socialization and understanding school might be very hard to do with a 5-year-old or a 6-year-old at home. And then taking into account what that school district is doing. If it's only one classroom, one teacher, social distancing, masks, as we said, they work, and that may work well. Or are you in a larger school setting where you're changing between lots of different people and groups? And so, you have to make that decision yourself. But yes, I'm not at work all the time, at home dealing with COVID and grocery shopping and going out. But we've done a lot of home time as well. And just, using that time to just get our relationships better and enjoy the fact that at least we're safe at home together.
Absolutely.
And looking at that benefit.
Sure, absolutely. Yeah, so you alluded to some of the other issues. I mean, we can't just think about medical problems. We can't just think about COVID. I mean, and we have a whole life to think about. I mean, work and kids, they have to grow. The big question for you is, how do you keep balance for yourself and make sure that
I think
you're winning?
Is a great question. It's very easy to lose yourself in all these other things, but I think some of the things that are so important is to take time for yourself. And whether that can be 5 or 10 minutes a day, in whichever way you can have some quiet and peace. For some people it might be meditating, for some people it might be praying, it might be just taking a walk outside. But really having that time for your own space and your own thoughts to not necessarily process through, but just give yourself time to let it just happen and experience it. I think sometimes we're always reacting and we don't get a chance to experience. I think the other thing that's very important is to try to stay active during this time. And at least when COVID started, it was a little bit easier with spring and summer months. You can always go outside. It's getting a little colder now maybe, but realizing staying active is just sort of very important. And lastly, I think that although we're social distancing, it doesn't mean we have to be socially isolated. I think let's use the technologies that we have to bring us closer. So now I FaceTime my mom who's in New York every day, as opposed to, going and seeing grandparents because you're scared, And I think it's just very important to realize how to use that technology to your best way, but not to feel that you have to isolate yourselves. Because it can be overwhelming. A national pandemic, other social injustices going on. You're a physician working in the front lines, literally seeing COVID patients. You have to come home and these kids in their schoolwork. Well, I'm not a teacher. How is a teacher going to help and do this? And then, if you have a small business, my husband actually has a small business where he was closed down for a while. How are we dealing with that? So there are all these things going on, but just making sure that you can stop, take some time for you, and realizing that you're not alone. And that's why I think not isolating yourself is very important, and realizing you actually do have a support network of a lot of people going through the same things.
Perfect. That's wonderful. Well, I really appreciate you sharing all that. I have family in other states, and they knew that here I'm in New Jersey on the front lines. And they're saying, we're worried about you, and we're proud of you at the same time. And I say, okay, thank you. But me to you, I'm proud of you because you're the one who's on the front line. And so I appreciate you for sharing what you experience with me, as well as the Winner's Circle. And it's been wonderful. Thanks for coming.
Thank you for having me, and I hope everyone continues to win.
Sure, thank you. So thank you for joining the Winner's Circle, everybody. Look forward to joining us here regularly, Mondays at 2 o'clock, Tuesdays at 6 o'clock, right here on RVN TV. I'm your host, Dr. Sean. Thank you for joining.